Hello, I'm Dr. Kim Allen Williams. I am the Chairman of Medicine at the University of Louisville, and I have been a vegan for 20 years and 3 months. I started because at the American College of Cardiology meeting in 2003, I found out that I had a very elevated cholesterol. I had a quite reasonable numbers, and then as happens to some people, maybe it's a little genetics, maybe it's a little bit of diet, and I was eating that American Heart Association chicken and fish, no skin, not fried, supposedly healthy, not healthy because it contained cholesterol. I was sensitive enough to it that my LDL, for those of you who like numbers, got up to 170. Fortunately, there was some little bits of vegan information about cholesterol and cardiac risk. Dean Ornish had published stuff. And right that month, that March of 2003, is when the Portfolio Vegan Diet was published in the Journal of the American Medical Association. I saw that and changed my diet immediately. And 6 weeks later, my LDL cholesterol was down to 90, almost cut 50% with diet.
Wow. Now, there's a lot of talk about LDL not really meaning a lot these days, or even HDL really not being that significant. Maybe it's smaller particles like lipoprotein little a. Maybe it's more a combination of triglyceride. The more you listen to other people like on the opposite side of the fence, it can get really confusing. Do you have any suggestions for those trying to make sense of all the misinformation out there or all the different information out there?
So the interesting part of this is that lipidology is an entire science, and people who think that they can capture it in one sentence or one phrase are shortchanging themselves. Lp(a) is a real phenomenon. It is basically a molecule that if it's high in your bloodstream, it makes you more likely to clot. Now, if you don't have any bad blood vessels and your LDL cholesterol is low, you probably aren't going to have much go wrong with that tendency to clot more. Whereas damaged blood vessels, absolutely. There's drugs being tested right now to try to lower it. Diet lowers it by a good 10%. We did that in a clinical trial, very similar to Baxter Montgomery, who did the same thing. It is a genetic risk. People should know what their Lp(a) is. Next one you mentioned was like the HDL. We just have to admit it. We had it wrong for about 60 years. HDL, the higher it is, the more heart attacks you have. That was the CAN-HEART trial. That was the Copenhagen trial. All of them showing the same thing, that there's yes, when it's low, it puts you at risk, but when it's high, it also puts you at risk. And so everyone chasing HDL as a marker of something that should be changed, it's never been proven. The pharmaceutical industry has spent billions of dollars. I could name them off: the fibric acid derivatives, niacin, torcetrapib, dalcetrapib, anacetrapib. All of them failed to lower mortality. And in fact, there was a slight nudge towards increased mortality in some of those trials, particularly the cetrapibs and also niacin. So it's probably something that we're going to continue to measure because it's the easiest way to calculate an LDL cholesterol is to do a total and then do an HDL and then get your non-HDL cholesterol and use some formula. The old Friedwald formula would take 1/5 of your triglycerides, and that would sort of estimate your so-called VLDL. But bottom line is that you shouldn't be using it as a target unless somebody comes out with something completely different than what we've done in the past. And so I always leave room for growth, but right now we're pretty much thinking we had it wrong for 60 years. Now, you also mentioned triglycerides. Really important because triglycerides are basically, unless it's a genetic issue, it's basically a referendum about what you've done, okay? If in the last 24 hours you're eating fried food, sweets, candy, donuts, refined grains, if you are eating fatty foods, animal products, then your alcohol, your triglycerides are going to be elevated. Now, it turns out that elevated triglyceride changes things. It changes your LDL and makes it small and dense. And those small, dense LDL particles are way more likely to give you plaque development than a nice, fluffy LDL particle. So when people say LDL isn't important, that's completely wrong. When they say it's not the whole story, now that part is true. So the other one that we have to mention is C-reactive protein, because inflammation is very complementary. It's lowered by statins it's lowered by a plant-based diet. And when you lower your C-reactive protein, you lower your risk. And so, yeah, LDL is not everything, but it's a lot.
C-reactive protein, Lp(a). Do you recommend we try to test for these things?
We do actually have that in our recommendation for certain people. Who are those people? Well, if you look at our prevention guidelines and our lipid guidelines, they have a very similar kind of approach. And that is to find out what the person's risk is. And the way we do that is a little app. It's called the ASCVD. That stands for atherosclerotic cardiovascular disease. The ASCVD risk calculator, anyone can put that in their search engine or in their app store. It'll pop up, okay? And it'll ask you, how old are you? What's your race? What's your gender? Are you a smoker? Are you diabetic? Yeah, what is the blood pressure reading that you want to put in right now? What is your latest cholesterol reading? You put those things in, and it'll tell you your 10-year risk of having heart attack, stroke, or death. If that risk is less than 5%, you're pretty much in the good group. You know, just exercise, do a plant-based diet, and you'll be fine. If you're above 20%, you're an extremely high risk group. You need medication and plant-based diet and exercise, primary prevention. You need to do everything that's in that document. Between those, there's two groups. One is above 7.5 to 20%. That is a risk group that really needs treatment as well, but you could do some other testing, like doing a coronary calcium score. It's a nice test, tells you whether or not there's plaque in your arteries that's calcified. It's not perfect because some people have no calcium in their plaque and they're still at risk. It's just it's not a lot of people. Okay? So you could pretty much use the calcium score in that range to tell if people are at risk. If you've got a 0 score, you don't need medication. If you have a little bit of a score, you need a medication, particularly statins. If the score is higher, we would actually use the statin and aspirin in the old days. Nowadays, we're tending to use clopidogrel or something else that's safer than aspirin. And if it's a really high score, you might actually consider having a stress test, particularly if it's high score in the important arteries like the left anterior descending, the left main. We take them a little more seriously when it's in those particular vessels because they cover a lot of territory in the heart. Now, what about 5% to 7.5? That's the group that really ought to have those tests. They got to find them online or talk to a doctor who does those kinds of tests with one of those fancy laboratory tests. You're going to have to pay out of pocket because insurance won't cover those tests. But chronic kidney disease, which you can find out easily with the regular blood tests. But if you have Lp(a) that's elevated, a high ApoB, if you have LDL particle size that's putting you at risk, any extra risk factor, including inflammatory conditions like rheumatoid arthritis or lupus, any of those conditions, you really should have at least the coronary calcium before you rule out being treated. And everybody should be doing a whole food plant-based diet and exercise.
So whole food plant-based diet, exercise. There's some other pillars of lifestyle medicine.
Yep.
Go ahead and share those if you don't mind.
So I'd refer everyone, because you're not going to necessarily remember everything I say, but you can always put in your search engine the words American Heart Association or AHA, Essential 8. Okay? And you'll see a nice little diagram that'll remind you of what we're talking about. Number 1, do not smoke. Nobody should be doing that. Number 2, watch your weight. Have a body mass index that is the formula that tells you what your weight divided by your height is. If you have a body mass index less than 25, you're doing pretty good in most cases. Okay? You should know what your cholesterol is. You want your LDL cholesterol particularly to be less than 100 unless you have disease, coronary disease, the most common disease of Americans. Then it needs to be less than 55. Okay? The next one is your blood pressure. We have defined a normal blood pressure as less than 120, elevated is 120 to 130, and hypertension is 130 and above. And if someone's in that range, they really need to do everything they can with lifestyle first, then medication to get that blood pressure down. The next one is blood sugar. You want it to be normal. You particularly want your hemoglobin A1C, that little measure of how big has your blood sugar been over the last few weeks. That actually turns out if you've got it in the less than 5.7%, great. If you're between 5.7 and 6.2, that is so-called pre-diabetes. It's time to take that seriously and change things with diet and exercise. If you're above 6.3, you're really in the diabetes range, and it's time to really work on that. Okay, the next one after smoking, cholesterol, diabetes, hypertension, is actually, and your weight, okay, is are you doing a whole food plant-based diet? Okay, and everyone should be following the dietary recommendations that we put in that guideline. You can argue back and forth about fish. The argument is that it reduces stroke. But that's not all we want to do with diet. We want to reduce heart disease as well, and that's why a whole food plant-based diet would be preferable. The next one, believe it or not, is actually sleep. And sleep disordered breathing, where people is becoming more common as our population gets bigger and bigger. When you're obese and someone tells you that you're snoring a lot and you're stopping breathing in the middle of the night, you might actually have a problem with your breathing, and it can it could certainly cause rhythm disturbances and actually death, as well as just worsening your blood pressure and changing your hormones so that you actually end up with more obesity. And last but not least, number 8 is exercise. Everybody should be doing at least 150 minutes of exercise per week. And that's kind of a primary prevention kind of thing. Do dynamic exercise. Try to add some high intensity exercise in there. But if you're really trying to treat something like the cholesterol, the diabetes, the high blood pressure, then you really do need to try to get to 300 minutes per week.
When I hear these things, like the 8 that you mentioned, the 6 pillars of lifestyle medicine, True North's 3 pillars or whatever, there's a lot of similarities between these, but if somebody's lacking in the department of love, whether it's self-love or love from others, none of these things are going to work, I feel like.
Well, there's good data for a loving environment and mindfulness and stress reduction. And stress reduction, mindfulness, that really falls into the category of like meditation, prayer, reading scripture, Tai Chi, massage therapy. There's data for each of those things. Blood pressure reduction, changing the brain chemistry so that people are calmer has real value. We should have been focused on this a long time ago. And I say that for a couple reasons. One is more recently, we recognize the presence of a disease. Okay, it's called Takotsubo cardiomyopathy. May not have heard of that one. Everybody's heard of it, but not really. Okay, so and what'll happen is you hear a story about an elderly woman who somebody knocks on the door and says, "I'm sorry to report your son just died in a car accident," and she grabs her chest, passes out, has an arrhythmia, and dies. Okay, everybody's heard these stories. Turns out it's not just something you see on television. There actually is damage that occurs to the heart from sudden stress. I have to admit to you, I was chief of cardiology at Wayne State in Detroit, and I saw more Takotsubo from poor people getting their Social Security check. They're 85 years old. This is the money they have to pay their rent and eat to live. And they'll go to one of those casinos and lose the money, and when they've lost the money, they get it. Chest pain, shortness of breath, they're dropping on the floor, resuscitated, come to the emergency room, and it has a particular pattern where it's called the apical balloon. The part of the heart is basically shaped like a cylinder, and the part of it that's farther away from the arteries will just be ballooned out, as if there was a heart attack cutting off the blood flow halfway through. When it wasn't, it was just so-called stress cardiomyopathy. So once we saw that, then we start to believe that anxiety and stress can actually play a role in the heart for reasons that we still don't understand completely. Is it that the brain makes the heart blood flow just suddenly stop that does it? Or is it the body chemistry, particularly catecholamines, otherwise known as adrenaline rush, that does it. But we don't get that when people jump out of airplanes. So it's something about the brain heart connection that makes that happen. Okay, now forget about Takasubo for a moment. Let's go to exactly the opposite to talk about what you're saying: loving environment and mindfulness and stress reduction. We've had this data that people have been quoting, so you've probably heard this one, about the rabbits. So the thing with the rabbits was published, I think, in 1978 for the first time.
Because they get heart attacks, I guess?
Well, yeah, rabbits get heart attack when they're in a laboratory, and people feed them animal products. There are no safe animal products to be eaten by a mammal. You're supposed to eat plants. That's humans, rabbits, goats, elephants, horses, cows, whatever. Supposed to be eating plants. And if you feed a human animal products, they get heart disease. If you feed a rabbit animal, they get heart disease. And so the one that people talk about, you can read all about it in International Journal of Disease Reversal and Prevention by Dean Ornish, where we're having a conversations with a legend. He really goes into it. But apparently, they have these stacks of laboratory animals, which we could all argue that they shouldn't be doing that, but it is proof of principle. Feed them mammal animals and they get heart disease, and that was what they were doing to study the heart disease in these animals. And the tech, who was supposed to be feeding them, ruined it. She was short in stature. She could reach easily the rabbits that were on the lowest set of cages. And so she would take them out and pet them. And they didn't develop heart disease. We should have known since the late 70s that the brain controls the heart. And stress is incredibly important. For decades, we were blowing it off when a person says they're under stress and their blood pressure is going wild, and you say, well, you just need a psychiatrist or something. It's not important for your heart. It's critically important. And so, Dean Ornish has been talking about this also for decades. The data is so important now that people believe Dean Ornish and criticize him at the same time, saying that vegan diet doesn't do anything. All you're doing is putting people in a loving environment, stopping from them smoking, them making exercise, and taking their stress away. Of course they're going to get better. Okay, and it's hard to argue because it's one composite program.
When it comes to love, could you be with somebody who isn't vegan?
Me personally?
Yeah.
I would find it really difficult, just for practical reasons. But it also means that you have a different philosophy, and couples really are going to do better when they're pulling in the same direction, even if they're for slightly different reasons. Okay, it may not be the easiest for a cardiology-driven vegan because the motivation is a little different and the diet might be a little different. But at least you can come together and you can agree that all three are important. That's the important thing.
And then next in line would be raising children vegan.
So I have 4 kids, 9 grandkids, very little vegan going on, and I would say part of that has to do with we hadn't really defined what a healthy diet was properly. And now we have much more data, and we should be coaching everybody about this. And by the way, anyone in my family who gets sick, they go vegan, and then they're better. And so everybody knows about it, but whether or not they do it personally, and I was like 47, before and I was motivated by the LDL cholesterol, as I said. So hopefully everybody else doesn't wait that long.
Is there anything to the grandmother and her lifestyle potentially having an effect on the mother's sex organs in a way that it affects the child in a way that in utero they may be already developing heart disease or some chronic disease? So
we actually have heard more about maternal, not grandmother necessarily, but maternal habits determining blood pressure, diabetes. It's a very serious thing that we're just starting to get a handle on. I'm hoping that we start to be able to pay more attention to it because it dovetails with our major epidemic that we have in this country that people aren't paying attention to, and that is maternal fetal mortality, particularly in the African American community. We have third world outcomes, 3 times the rate of other races. Most of it is cardiovascular, which means that most of it's nutrition and diet. And I know there was an Olympian who died 8 months pregnant with preeclampsia a couple weeks ago, If you look at the data on preeclampsia and plant-based diet, it's actually pretty encouraging that it's something that we could lessen, if not eliminate.
Do you feel like the most protective way to raise a child might be a whole food plant-based diet?
So I definitely believe that it would be, but I'm crossing over from data, which I normally have, to belief based on pathophysiology and epidemiology. It makes the most sense. I would like to see some huge randomized trials, but those trials are really hard to do. Why? We have principles when we're doing research. We don't do people who are in jails. We don't do people, like what happened with the Tuskegee study, where African American men were given a disease and then not given the treatment after the treatment was developed. That has cast a pall on all kinds of research, including the things that happened in Nazi Germany. Those types of experiments are something that we really try to protect every vulnerable population. So I can't see somebody doing, the idea of, the data would have to be really strong, which I think it is, but you'd have to convince everyone. And if you convinced everyone, you wouldn't have to do the trial. But if you can, until you convinced everyone, no one would approve it, because if there's a question which would make you do the trial, they wouldn't want to take the chance. Now, those of us who are paying closer attention to the obesity epidemic, the hypertension, the diabetes epidemic, where we're having adult onset, we used to call it adult onset, type 2 diabetes in 8-year-olds, you'd have to come to the conclusion that we're wrong not to do those studies, or forget the studies, just change everybody's diet. That is an area that if we don't pay attention to it, we're going to have generations of unsustainable healthcare costs.
What I'm hearing you say is it's really hard to answer that question because the data is not there and the data is hard to get. If you could have a child right now, would you do that right now? Would you raise them?
Oh, certainly.
Whole
Yeah, I
food
would.
plant-based?
Right, man, and
would you have any fear whatsoever, any potential maybe you're not doing the right thing, or would you be absolutely confident doing that?
Absolutely confident. And that's because I've seen plenty of people who are raising their kids on a whole food plant-based diet. Everybody remembers the B12 issue, okay? And my kids grew up without eating red meat. They're all fine, perfectly fine. Got some arguments with our church. We got arguments with a lot of people, but the fact of the matter is they all did pretty good. Now, the fact is, we do need to have the kind of dietary patterns that will sustain the planet. So when you talk about kids, I'm thinking of my grandchildren. I got 9 of them, and so I am a little more concerned about the planet than I was. I won't be here in 80 years, I don't think, but my kids will be, or my kids' kids, and I want them to have a place to live. So that means, why don't we all just think about that and do the kinds of things with our personal habits that are going to leave something for the next couple generations.
Yeah. So what I'm hearing you say is foster a future of food forests, community gardens, food not lawns, veganic farming, instead of concentrated animal feeding operations and slaughterhouses.
Agree completely.
There's also, by the time you're 10 on the standard American diet, you probably already got the first stage of heart disease.
It's definitely true. And unfortunately, autopsies on 3-year-olds should never have autopsies, have actually shown that American diet, the beginning of what they call the fatty streak of plaque forming in arteries. We've known about boys in Korea since the 50s that the American diet gave fatty streaks and starting the beginning of plaque. And so if we had that data, why wouldn't we do something about it? The American Academy of Pediatrics did come out and say that starting at I think 10 or 11 or so, you should be testing the cholesterol. That'll go a long way to at least getting people to think about, when you have a high number, what is it that I can do about it? And hopefully it's medication and lifestyle for the people who are critical, and the people who are not critical yet, but they're high, try the lifestyle. That's what all of our guidelines say. I do like to think, for my grandkids about the planet and, animal rights and that sort of thing. But we have big problems, we have bigger fish to fry without the fish. Or the frying. And that is that we have a non-sustainable, toxic level of healthcare spending in this country. And if either people are not patriotic, or they're plant-based. And I'm saying that because everyone has to know that Medicare is going broke and that our lifestyle choices are making that happen. And so I just challenge everyone to look at the healthcare financing in this country and not say, hey, I want to make a difference. I want to help my neighbor who's sick. I want to leave something for them. I want to pay into that system and never use a dime of it because I do what's right for my body.
And people are busy and it's hard to really make sense of, oh, here's a study. What does this mean in the grand scheme of things? How can you look at the totality of evidence? Where is the most compelling evidence for what you're saying?
I'd say the American College of Cardiology, American Heart Association 2019 Prevention Guidelines, Section 3.1. It has to be succinct, has to be evidence-based with references. It's very digestible, no pun intended, and you will understand exactly why the guidelines talk about eating plants. We do try to, as a medical society, take all of the medical literature, put people in a room, experts, and argue with each other. And so when I'm writing guidelines, rule number one is drop your ego at the door because you're going to get pummeled. And you just come up with a document that everybody can live with based on the best evidence available. And the evidence keeps changing, sure. And so, we have to admit that we're going to get smarter and smarter, and that's how we can find out that we had it wrong about HDL for 60 years, that sort of thing.
Yeah. And then, what kind of foods do you eat?
Whole food, plant-based diet.
So, what does a day of eating look like for you on a typical ideal day?
I kind of joke that Dr. Esselstyn, I heard him say in a conference that there's 29,000 beans, grains, fruits, and vegetables, and of course, I'm a big believer in nuts and seeds, and so I throw those in there. But when I tried Googling it, I only got 21,000.
Yeah.
But my point is, I would eat all of those things. If I could make some points, it would be avoidance. And that is, the sugar-sweetened beverages. They're vegan, but they're not healthy. Sugary desserts. I love vegan ice cream. Not going to eat vegan ice cream, okay, because of the sugar content. If we could find a way to do that, and there are ways, such as
frozen bananas.
Frozen bananas are absolutely tremendous. So yes, Rose makes it nice cream. I think is what she calls it, and that's good stuff. And so, but we want to avoid the sugar without the fiber, and that's what. So whenever I want something sweet, I go for some fruit or something like that. So avoiding refined grains and any oil that has a lot of saturated fat, and that's pretty much my diet.
Do you feel like it's necessary to supplement like your omegas?
So the omega-3 story is compelling, but if you're doing a lot of nuts and seeds, particularly walnuts and chia seeds and flax seeds, you're going to do fine with that. If we talk about supplements, really important to do B12. Cows and pigs eat dirt, and so when you're eating them, you're getting the bacteria out of the soil. That B12 that they're getting, well, we could either eat animals, which they would find objectionable. You could eat the dirt or dirty vegetables. That's probably not so good. Or just take a B12 supplement. So that's what I do.
Well, what about oil?
It's not as controversial as one would think. That is, we have a couple of really stellar people with really good outcomes who avoid oil altogether. And then you have a couple other people. This was geography, by the way. Cleveland, Santa Rosa. Then you have Joel Furman. I think he moved to Southern California. Yeah, exactly. And Dean Ornish and other people who are not afraid of oil. And so I would say I've listened to all of them. I've looked at all of the data as the journal editor. Fact is that the polyphenols and the extra virgin olive oil are really good for you, unless you're overweight. So when Dr. Esselstyn is talking to people which is the majority of people, they're overweight, they really should try no oil, at least until they get the weight down. Now, if you're talking about a skinny tennis player like myself with a bad LDL, I should be on as much olive oil as I can get. There was a wonderful Neil Barnard study that had a big surprise published not too long ago, where he did vegan versus Mediterranean. It's a weight loss study. And what he found is that those darn polyphenols, and gave a tremendous reduction in blood pressure. Wow. Oil can be very helpful. Anything with monounsaturated and polyunsaturated fat has been shown consistently for years to decrease LDL cholesterol and decrease mortality. Whereas if it's saturated fat, and I know people love their coconut oil, and but if you're consuming coconut oil in a curry or vegan ice cream or something, it may taste really good, but it's going to raise your LDL cholesterol, and high levels of saturated fat will increase your mortality. Trans fat are the worst. Don't have to worry about that. It can't be sold publicly in United States, Denmark, Sweden, and Canada.
What's the proper use of oil, though? Like, obviously you don't want to fry foods, right? And just maybe a little in a salad or something?
Oh, gosh. So now we're really controversial. Okay, so you say you should not fry food. I'm gonna, one of the first rules of Fight Club is you don't talk about Fight Club, right? But I did get into a battle with I'm not gonna say which journal. We were doing a study of the healthiness of vegan food, and when I looked critically at the things, first of all, you can't find how healthy or unhealthy it is. You can taste salty, but you can't find it unless it's a major chain. That is, in the United States, it's a law. If you have a chain of more than 20 restaurants, you must list online what all of the nutrition is in each of your dishes. So for the big chains, no problem. You can see how much sodium there is, how much saturated fat. You can find out everything. If it's less than 20, which is most of the restaurants, you can't find that out. What can you do? You can look at the components of it and see if it's going to have a saturated fat, like some of the fake meats have high amounts of saturated fat. Then you have refined grains. That is, it's sugar-sweetened stuff and white flour, white rice, all of which has been shown to increase mortality. The last one is fried food, which we've all been told is bad for you. When you look at the data isn't all that bad. We were told that if you take an oil and heat it at high heat, you will pop the double bonds and you will make it more saturated. Well, it turns out that isn't true at all for something like a canola oil, which has a lot of monounsaturated fat, or olive oil. It just wasn't true, not at the heat that people are frying. So if you are burning it, that might change the chemical composition. Let's argue the other side. As I mentioned with Caldwell Esselstyn's diet, he's feeding a lot of people who are overweight or obese. And once you start feeding those people fat, it will actually increase their central obesity, increase their insulin levels, and drive more plaque. So of course you want to avoid it. But again, a thin person with a bad LDL cholesterol, getting monounsaturated and polyunsaturated fat could actually be beneficial, and that's why the data shows a decrease in mortality.
Even if it's fried?
Yeah, because you're not changing the composition. It turns out that was something we were told, but the proof is actually, when you look at it chemically, it has not made any difference. So anyway, I ended up losing that fight with the reviewer. He says, because what we were doing is taking off a half a point. Whole point for refined grains, whole point for saturated fat, and half a point for fatty foods. May have to rethink it, but the data is very clear that it's just not as bad as we thought, unless you're overweight. And maybe maybe the reviewer is right, because we have such a problem with obesity, diabesity in this country. It's so expensive. Maybe I should just cave and say, take a point off and redo our analysis.
Do you have any quotes you want to share?
So
you're pretty famous for a couple quotes.
I'm famous for quotes. There are quotes and there's quips. Okay. And so I actually have a bunch of them. Give me a topic.
One that might be encouraging, maybe, to help people get inspired to do this.
Here you go. I would say if people were to do the best thing for themselves, do the best thing for the planet with their nutrition, the rest of your life will be the best of your life.
Where are we at today?
So yeah, the National Health Association is wonderful people, room full of people who are really interested in living a plant-based lifestyle and improving their health, and a wonderful audience that I'll lecture to for an hour and a half. absolutely wonderful. It was great to talk to so many of them who wanted to come up and talk afterwards. But I did have one suggestion, because it's sold out. In order to qualify to come next year, you have to bring a non-vegan with you.
Ooh, good idea.
Yeah, Mark Huberman actually liked that. I don't know that you can really do it, but that would be really good. Because I sometimes feel like we're preaching to the choir.
Yeah. But sometimes the choir needs a little support.
Particularly when it's a fast-moving area. Yeah. So my talk is all about data, and to be able to give people data to back up, because they're going to go out. We're 3 to 5% of our population in the United States is whole food, plant-based, vegan. I mean, seriously. So we need to give them all the tools that they need to go out and change everybody else, starting with their own doctor, because the leading cause of death of cardiologists is still heart disease. Wow. And so we need to fix our medical community first, and that'll fix everybody else.
You mentioned the 3.5 percent of population is vegan. One of the fastest demographics are Black people, is what I've heard. And why do you think that might be?
So first of all, I've heard that. I haven't seen real good numbers. It's the most important thing that we could do. So let's think about this. I grew up on the south side of Chicago. I'd say I grew up in Inglewood, but I was only in Inglewood for a small period of time. Why? We were so poor that we never could pay the rent on time, so we were thrown out every year. So I went to 8 different grammar schools. Okay. But Inglewood, Gresham, Auburn Park, and south side of Chicago, these are areas with a high cardiovascular mortality and hospitals that don't offer the services that are needed. You have a couple of them, Chicago's on the south side in the Woodlawn area, or just north of it. When you compare our outcomes on the south side of Chicago, like Inglewood, to the north side, like Streeterville, which is up by Northwestern, close to the Magnificent Mile, there's a 30.1 year life expectancy difference. That's unconscionable, okay? And so when you look at the 21% higher cardiovascular mortality rate, I'm not even talking about gangs and drugs or other social evils, just talking about heart disease and the risk factors that we have, and the fact that over 50% of all African Americans in the United States, adults, have some form of heart disease. And then there's the kidney disease issue, which makes more heart disease. We are 12% of the population and 35% of the dialysis patients. Wow. If ever there was an opportunity to make things better with health equity, it would be to change the diet of the African American community. So I spent a lot of time talking about it. I haven't seen necessarily a lot of results. What we do in Louisville is the same thing that we did on the south and west side of Chicago. We go to community churches and community groups, and we actually do the finger stick for cholesterol, the blood pressure, put everything in that little calculator, tell people what their risk is, and then try to get them to do give them their Association of Black Cardiologists plant-based diet as a handout. Try to get people to understand that they can control their outcome, okay, if they control their input. I got to write that one down. Okay. Yeah. Another quip.
Is there anything that we didn't talk about that you think would be really great to get out there?
The real issue with Medicare, I would probably go back and emphasize the healthcare financing issue, where the Medicare trustees say that we are going to go broke. Unless we change the way healthcare is done, what that looks like is going to be a 30% decrease in physician fees and hospital fees, which is not sustainable, except maybe some large universities. And if University of Louisville gets back to the Final Four a few times, maybe we could survive all that, okay? But this is going to be tough. We're going to have denial of care for the poor. The rich will just not care. The middle class will be stressed, and the poor will be disenfranchised. We can't let that happen. And so how do we stop spending $160 billion a year on diabetes? Change the food. The reason to talk about it now is that not too many people say things nice about Richard Milhous Nixon, but he did one really good thing back in 1969 or so. He put together the first Food, Nutrition, and Hunger Conference. It didn't have all the best evidence back then that we have now to say, hey, everybody needs to go vegan. But we nowadays, the Biden administration did another one, first time in over 50 years. And that conference in September of 22, I was one of probably 200 people, maybe even more, who were on various committees to try to give recommendations to the White House. And I ended up not being able to go to the conference because my invite came on the morning of when they told me how to get through security. That's when I found out that I was invited, and it was too late to get on a plane and go. So I sat at home, watched it with my skin just thrilled that listening to the President of the United States talk about the things that I had recommended. Wow. That included education. People talk about food deserts. I don't think they're food deserts. I think it's missing an S. It's food desserts. That is, people who are in a store in an African American community or a poor community, they sell bad food like desserts because that's what people are buying. They're not in the healthcare business. They're in the keep my store open business. Okay? And so if we change with education, community, public service, every way that we can change people's understanding of food, we can get them to buy better food. And then the food deserts go away because the local store carries what people are buying. Why would they buy fresh fruits and vegetables if they're going to sit there and rot and be a financial loss to them? Okay, so that's my theory. And President Biden actually said that. We're going to do community education. My next one was to actually put food labels. We're not the only ones to put red, yellow, and green. France did it as a pilot. Australia did it. Austria's done it. Every time somebody does that, you see the same thing. It changes purchasing behavior. If you know that processed meat, have a little disclaimer on there. There's a thing on the pack of cigarettes that says may cause cancer, right, or health effects. Well, if you have a World Health Organization Class 1 carcinogen, which is processed meat, why not put a label on it and say this is red and this is why? They say they're going to try that. I don't know when, I don't know where, I don't know how big, but he talked about it. He wanted to change the SNAP program. There's not a lot of momentum for taking SNAP recipients and saying you can't buy bad food. But you could say you can buy more good food than you could before. We're going to increase your benefit as long as you're doing fresh and fruits and vegetables, nuts, seeds, okay, the stuff that's really going to be helpful. The next one that I was hoping he would say that I'd recommended was change the television commercials. Don't let children see fast food commercials with all these negative things that are going to harm human health, create obesity, diabetes. He didn't say that one. But I was very thrilled that they're going to take this on. And there were plenty of other recommendations, all of which would try to stamp out, particularly rural hunger they were very concerned about. I'm very concerned about urban hunger. And hunger in terms of not quantity of food, but quality. Let's change the fundamentals of our food system. Right now, it's a huge system. It's a very long food chain, and it bends towards disease and death. We can change that.
You are like a legend, and it's an honor to have you right here. And you've had a long day, I'm sure. You flew in to do this talk, and you've done the talk, and you got to get up early. I'm sure you're ready to get to bed, and thank you.
Really appreciate it. Thanks so much. Thanks, Jeff.